Hi, this is Jeff Zeig. I'm in Anaheim, California. Again, site visit for the December 2017 Evolution of Psychotherapy Conference with another 5-minute tip for therapists. Let's think for a moment about starting a session. Now, if you're a physician and you're starting a consultation, there's things that you need to do. You need to do a history, you need to do a physical examination, you need to do tests, you need to compile these things, create a treatment plan. Now, psychotherapy has been medicalized, and we've been trained to think like physicians, that we need to conglomerate a bunch of data before we're ready to spring into action. What I would like to introduce is a Beethoven principle: jump into action. In the Fifth Symphony, Beethoven presents 2 notes, 4 tones, that turn out to be the 2 notes and 4 tones that are most popular in all of Western music, most renowned in all of Western music. Beethoven jumps into action. When Tolstoy wrote Anna Karenina, suddenly he jumped into action. When Herman Melville wrote Moby Dick, there's hundreds of pages before we get into the battle. When Tolstoy wrote Anna Karenina, suddenly we're involved in family life. Pages later, we learn that Count Vorosky is bald. We learn something about his physical characteristics. But the important thing that Tolstoy did, following the Beethoven principle, jump into action. We can jump into action when we're therapists because assessment can be a byproduct of intervention. Well, certainly you can't do that in medicine, but in psychotherapy, as you intervene, you learn something about how the client will think, feel, perceive what it is that you're trying to communicate to the client. One of the ways that I jump into action is I listen to big words. When the client initially in the session gives me a concept that I think is big, like, for example, I was doing a demonstration of therapy, and at one of the conferences of the Erickson Foundation, the Brief Therapy Conference in 2016, and the client started to talk about uncertainty. I said, okay, now that was at the beginning of the session. So the client said, uncertainty. I said, okay, well, think for a moment, where in your body is your uncertainty? And then I said, okay, well, give me your uncertainty. And then I started to find a description of his uncertainty. I started to find qualities that uncertainty represented, and then I honored his uncertainty, because certainly it's been part of his life and all parts have value. An important thing is not to try to eliminate things in people's life, but try to find the intrinsic value, stay positive, stay solution focused. Once I had his uncertainty, then I could put it aside for a minute, and then I could talk with him in therapeutic terms about things that he could accomplish. Then what I did was I used uncertainty not just as a metaphor, but I used uncertainty as a barometer of change, so that when I brought back uncertainty after doing some therapeutic work, I could ask him, well, how is uncertainty different now? And then I could take uncertainty, put it aside, do more therapeutic work, bring the uncertainty back. So in a brief therapy session, rather than spending a lot of time at gathering history, rather than spending a lot of time in doing assessment, in a social intervention different than a dental procedure or a medical procedure, we can spring into action. Our intervention leads to assessment. If you want to experiment with this, listen to the big concepts, the big words that your client says, jump on those big words immediately, make therapy a symbolic drama of change, and spring into action. This is Jeff Zeig. I'm in Anaheim, California, with another 5-minute tip for therapists. Thank you so much.